Hello everybody. Am I audible and visible, guys? Okay. I'm good. How is everybody doing? Am I audible and visible? Just give me a thumbs up. Everybody, am I audible and visible? So, let me start with the class. Yeah, I guess I'm audible and visible. Class. Okay. So welcome back to this weekly TND episode. No, we've had one session before. We've had a session on epidemiology part. So you can check out the series. Okay, it is a 50-day PSM series. Okay. So it is a 50-day PSM series. So we've had one session of this, which was epidemiology that has already been conducted. Today we are going to have a recap of all the topics that were discussed in this last week. Okay. So we are going to target today screening and vaccines and NIS. Demography will be covered in week 3. Okay. Demography is going to be covered in third week, everybody. Just give me 1 second. Okay. All right, just give me 1 second. Okay, chalo. So can we start? Are you ready for your test and discussion? So you can keep, scoring, giving scores to yourself as and how the session proceeds. Okay, we have almost 20 questions. So you can mark yourself, okay, are you marking it correctly or not? Okay, so chalo, let us start with the first MCQ for the day. In case of an outbreak of measles, remember today the test and discussion is on on vaccines, NIS as well as screening. Okay. So in case of an outbreak of measles vaccine should be given within how many days of exposure? Anybody? Also, some of you messaged me that, ma'am, is this for NICT only? Is it not for FMG exams? Okay, please remember it is for NICT, it is for FMG exams both, guys. Okay, it's a TND series. Right now we're having a 50-day PSM series. Every day the test is happening. Telegram quiz is happening at 8 p.m. on my Telegram channel. Then I give you the week's topic and then you have to prepare it, and then we're going to have a test and discussion every Saturday. All right, we're having it on every Saturday. If I can't take it on any Saturday, then I will have it for the next day, but we will definitely be covering every week's topics in the form of a test and discussion. Okay. So tell me the answer to this. Very good. In case of an outbreak of measles vaccine should be given within 3 days of exposure. Now, why do you give the measles vaccine within 3 days of exposure? Because remember one thing. What is the natural incubation period of measles, guys? Natural incubation period of measles is how much? Natural incubation period of measles, if you talk about as a disease, is 10 to 14 days. Okay. And the antibodies post vaccination, all right, they form within, okay, antibody formation post vaccination, antibody post vaccination. Okay, so incubation period post vaccination is 7 to 10 days. So if you want to get the benefit of measles vaccine, it should be given within 3 days of exposure. Got it, everybody? All right, I've given you some golden points also. If vaccine is given within 2 to 3 days of exposure, the replication of virus vaccine takes preference over replication of the wild virus. All right, and susceptible contacts over the age of 9 to 12 months may be protected against measles with measles vaccine provided it is given within 3 days of exposure. Suppose किसी के घर में measles का एक केस आता है, ठीक है, then susceptible contacts can be given the vaccine and protect them, provided you have to give them within 3 days of exposure. Everybody give me a thumbs up if you've understood this first question. Also here I would like to give you a golden point that post disaster all vaccines are contraindicated, except which one do you give, guys? Post disaster, except measles vaccine is given post disaster. Okay, it was a good question, like it was a decent question which can turn up in NICT also as well as FMG, because you can get confused and you can end up marking 7 days, but the correct answer to this is 3 days. Okay, moving to the next question. First you read it, then I will explain to you. Take your time. Oh, I'll have to shorten my image a bit. Yeah, so read this question and then I will explain to you. Some signal ka issue hai maybe. Let me open this door and see. Okay, take your time, everybody. Read this question. I'm not going to read it for you. You have to read it yourself, everybody. जस्ट इमेजिन कि आपके पास टेस्ट पेपर आया हुआ है, आपके पास ये क्वेश्चन आया है एंड यू हैव टू सॉल्व दिस. ओके, सो रीड इट, then I'll read it once you've started putting your answers. Take your time, no rush, try to do it. Okay, SS has given the answer. Gurmeet, anybody else's answer also? Okay, now see, the question said a woman has brought her 11-month-old baby to the vaccination clinic. The woman informs the doctor that the child had received 2 doses of DPT, hepatitis B, HIV vaccines as per NIS at 6 and 10 weeks of age. However, as the baby was not well, the baby could not receive the third dose of respective vaccines at 14 weeks. What should the doctor's plan of action be? Should you restart the vaccination schedule? Please remember, you are never ever going to restart. Okay, you will never restart. You never need to restart. Never restart. You can start from where you left. You don't need to restart. Okay. Resume schedule but supplement with one additional dose. Why should we give one additional dose for required efficacy? No. Resume schedule and give only the third dose? Yes, you can resume the schedule. Okay, from where? Like the baby has come at 11 months. Now we know that DPT vaccine alone, okay, can be given up to 7 years. Okay, or so you can start. Even if you are administering pentavalent, it can be given up to 1 year, right? So you can start from where the schedule was left. So resume the schedule and you need to give only the third dose. 2 doses are sufficient and third dose is not required? No, that is also not the correct answer. Did you all understand this question? Why did I give you this question? Because I just want to make one point clear to all of you that you never need to restart the vaccination schedule. Okay, from where it was left, you can continue from there. No additional doses are required. जितना dose चाहिए उसी को आपको खत्म करना है. All right? Okay. चलो, let's go to the next MCQ, everybody. All right, look at this question. Give me one moment. Let me see. Okay, what is your answer to this one, guys? I don't know why it's coming. I have to check for it though. Okay, so look at the MCQ, everybody. What does the question says? The question says that a 9-month-old baby was brought to routine immunization. Okay? However, the mother of the baby informed the doctor that the child is on prednisolone for the last, oh, it's been missed, for the last 6 weeks. Okay? All the following vaccines can be administered to the baby except. So what is your answer over here? Now the baby is on tap prednisolone for the last 6 weeks. So which vaccines are you not going to give over here? Anybody? This is a simple question where I just want you to answer one simple point. Yes, very good, Aisha. Because any baby who is, who is in an immunocompromised state, immunosuppressed state, the immunity is poor, okay, all live vaccines are contraindicated. Okay, all live vaccines are contraindicated. Now, pentavalent here is not a live vaccine, it's a combination vaccine. IPV is a killed vaccine. Pneumococcal again is a pneumococcal vaccine is a subunit vaccine. The only live vaccine here is MR vaccine. Okay, this is which type of vaccine? It is a live vaccine. So it is contraindicated. Any baby who is on steroids, everybody, we cannot give him any live vaccine. Did you all understand this question? So they can trick you. Instead of asking you directly, वो आपसे पूछ सकते हैं, the baby was on prednisolone for the last 6 weeks. Okay, so we all know that the baby is on steroids. So which vaccine you cannot give? the live vaccine cannot be given. Clear? Everybody give me a thumbs up for this question. So we are so far done with. You can score yourselves also. Question 1 is over. Question 2 is over. And also we are done with question number 3. Okay, question 1 is over, question 2 is over, and also we are done with question number 3. Let's move to the next one, everybody. Chalo. All of the following vaccines can be administered via the following routes except anybody. Now figure out which route of vaccine administration it is and then give your answer. This is question number 4. All of the following vaccines can be administered via the following route except now which route is, guys, which route is this? Now this can come in INI-CT also, this can come in NEET-PG also, this can come in fmge exams also. I'm just asking you the various routes of vaccine administration. Now which route is this? As you can see, it is at an angle of 10 to 15 degree. Now when it is at an angle of 10 to 15 degree, it is intradermal route. Now fractional IPV is what? Fractional IPV is 1/5 of full dose. Okay, 1/5 of full dose, which is how much? Full dose is 0.5 ml, so 1/5 of full dose is 0.1 ml. Okay, BCG again is given by intradermal route, and BCG इंडिया में किस आर्म में लगता है? BCG इंडिया में लगता है लेफ्ट आर्म में. फ्रैक्शनल IPV ऑल्सो इंट्राडर्मल रूट किस आर्म में लगता है? राइट अपर आर्म में. ठीक है. रेबीज वी ऑल नो इन इंडिया वी प्रेफर द अपडेटेड थाई रेड क्रॉस रेजिमेन. ओके, एंड थाई रेड RED D से it is which route, everybody? Intradermal route. So which is the vaccine which cannot be administered by this route? It is nothing but Japanese encephalitis vaccine. Okay, now Japanese encephalitis, you have live also and you have killed JE also. Live JE is which one? Live JE is SA 14-14-2. Okay, the live JE which is given, it is given at 9 months, and live JE is given subcutaneous. Alright, live JE आप कैसे देते हो? Live JE हम लोग देते हैं सबक्यूटेनियस रूट से. किस आर्म में देते हैं? लेफ्ट अपर आर्म. ओके, लेफ्ट अपर आर्म. बट इफ आई एम एडमिनिस्टरिंग नाउ इन आर नेशनल इम्यूनाइजेशन स्केड्यूल, एवरीबडी वी प्रेफर टू गिव द killed Japanese encephalitis vaccine, and this is given 0.5 ml. This is given in the intramuscular route and it is given in the thigh. Okay, usually we give it in the left thigh. So Japanese encephalitis is the one which is not given by intradermal route. Clear? Everybody give me a thumbs up over here. Give me a thumbs up over here. Nakayama, Beijing, all those are not used, so you don't have to worry about them. The new Japanese encephalitis, the killed one which is there, is Genvac. Okay, that is the one we are using. All right, chalo. Now suppose you had this image. Suppose you had this image, everybody. Suppose you had this image. What angle is this? 45 degree पे कौन सा angle, कौन सा vaccine administer किया जाता है? या this is which route? This is the subcutaneous route. And if I inject the vaccine at 90 degree, everybody, this is going to be the intramuscular route. So you need to know the routes as well, guys, and you need to know your NIS schedule in and out so that you don't make up any mistake in the route administration. ठीक है? Chalo, let's go to the next question. So that was question number 4. Coming to question number 5. Take your time. Identify the correct statement about the equipment shown in the image. आराम से time लो and try out this question. I'm not saying anything. You think that you're sitting in a test. ओके, और मतलब टेस्ट में ही बैठे हो. ट्राई टू मार्क इट योर सेल्फ. टेक योर टाइम. आइडेंटिफाई द करेक्ट स्टेटमेंट्स अबाउट द इक्विपमेंट. नो रश. Let's see who gives the answer first. But even if you're giving the answer first, try to give the correct answer. Okay, KKK has given 2. KKK लिख रहा है 2. Arpit is writing third option. Okay, let's see. Akansha is also writing the third option. Okay. Priyanshi is writing the second one. Dr. Solia's the first. Gurmeet the third. Rahul the second, Priya the second. So most of you are writing either the second option or you're writing either the third option. Okay, सबसे पहले, okay, I've got one answer as option 5 also. Sparsh is writing 5, Destination is writing 5. So let me see who's given the correct answer. First of all, tell me this is which instrument. First of all, tell me this is which equipment, everybody. ये कौन सा equipment है? Which equipment is it of cold chain? Everybody, which equipment it is of cold chain? So we all know this is an ILR. Okay, I have given you question about an ILR. Okay, what is ILR? Ice-lined refrigerator. Okay, I've given you a question about ILR. What is this? Ice-lined refrigerator. Okay, so that's the question I've given you about. Okay, very good. Now let us take up each option one by one. Okay, now this can be a question which can come to trick you in your NICT as well. Okay, look, most important equipment of cold chain. Do you agree to this statement? Yes, true. Okay, ILR definitely is the most important equipment of cold chain. Look at the second one. Vaccine stored at the bottommost of an ILR is reconstituted BCG. Is it reconstituted BCG? Can you use it beyond 4 hours? No. So what was the mnemonic that I have given you? R bomb. Most heat sensitive, everybody, is reconstituted BCG. Okay. After that it is what? OPV. After that it is what? Measles. And at the bottommost of an ILR, when you open an ILR, you open it from the top. All cold air goes and settles at the bottom. So at the bottom you keep heat sensitive vaccine. Reconstituted BCG सबसे ज़्यादा heat sensitive है, but you can't keep it because you can use it only up to 4 hours, guys. What is the next in the line? OPV. So the vaccine stored at the bottommost of an ILR is reconstituted BCG. No, it is OPV. ठीक है, ध्यान से सुनना, कोई हड़बड़ी नहीं है. All right. Next, look at the next option. Dial thermometer is used to monitor the temperature of the ILR once in a day. Is it correct or is it false? Tell me, true or false? Look at option C, guys. Dial thermometer is used to monitor the temperature of an ILR once in a day. No. No, this again is false. Okay, dial thermometer is used to monitor the temperature of an ILR, guys, twice in a day. Twice in a day. And who has to monitor the temperature? Whose responsibility it is to monitor the temperature? It's not the responsibility of any staff nurse or anybody. No. First of all, you don't have ILRs at subcenters. Okay, you have it from PHC level upwards. Okay, so it is the duty of the medical officer. Next time they can ask you that. Okay. Look at option D. Vitamin A bottle can be stored in this equipment. Really? Yes, very good. Arpit has also written one thing, thermocouple. Absolutely correct, Arpit. Dial thermometer is based on the principle of what? It's based on the principle of thermocouple. Okay. Then, vitamin A bottle can be stored in the equipment? No, this again is false. Do you need cold chain temperature to store vitamin A bottle? No. Vitamin A bottle को आप कहाँ store कर सकते हो? You can store it in room temperature. Okay, you can store it in room temperature away from direct sunlight. You don't have to store it in in an ILR. You don't have to store it in cold chain. Not in cold chain. Okay, not in cold chain. Look at option E. Distilled water can be stored in the equipment. Absolutely true. Absolutely true. See, distilled water क्या है? Distilled water is a diluent. Diluent आप ILR में आराम से रख सकते हो. ठीक है? You can keep the diluent in an ILR. Okay, suppose I don't have space in an ILR, then I can keep the diluent at room temperature, but then 24 hours prior to the session, I have to keep it in the ILR so that it comes at the same temperature as the vaccine. Are you understanding? So इसमें सही कौन सा है? Option C. So how many of you got this correct? See, it was just at giving you a tricky one. अब इसी question में से ना question 5 में से ही बहुत सारे MCQs निकल जाते हैं. ठीक है, इसी question में से बहुत सारे MCQs निकल जाते हैं. ओके, डिस्टिल्ड वाटर डाइलुएंट है. डाइलुएंट को आप रूम टेम्परेचर में भी रख सकते हो, बट 24 आवर्स प्रायर टू द सेशन आपको उसको ILR में रखना है. ठीक है, सो दैट इट कम्स एट द सेम टेम्परेचर एज द वैक्सीन. ठीक है, एवरीबडी. बट इफ यू हैव स्पेस इन एन ILR, यू कैन store your diluent there. Look over here. Diluent, isn't it kept in an ILR? You can store in an ILR. Which is the vaccine at the bottom most? OPV. Okay, which is at the topmost? Hepatitis B vaccine. Clear? Everybody, did you understand this question? Give me a thumbs up if you all understood question number 5. Sabko samajh aaya? Okay, so one MCQ we've tried to give an answer to at least 5 other MCQs. Give me a thumbs up. Everybody got this correct? I mean, even if you did not, I hope all of you understood this. Okay? Chalo, moving to question number 6 of the day. Read it yourself and mark it. ये क्या हो गया? Don't know what happened again. Just a second. Can you see the question, everybody, now? Okay. So mark the answer to this. Okay, I've not got answers yet. Very good, everybody. So what is your answer over here? First of all, you remember sampling technology, which is used for evaluation of immunization coverage. We all use cluster random sampling. So this goes, this goes. Now you have to survey children up to which age group? Cluster random sampling, children aged 12 to 23 months are surveyed. Okay, surveyed. Surveyed how many, what age children? 12 to 23 months. Okay, we use what? Cluster random sampling, and we survey children 12 to 23 months. और कितने clusters बनते हैं guys? 30 clusters. In each clusters we take 7 children. Okay, and these children का age group क्या है? 12 to 23 months. Got it? Everybody, not up to 12 months. सबसे common mistake है guys. Students end up marking up to 12 months. No, क्या है age group? Up to, you are going to survey children up to 12 to 23 months. And which type of sampling are we using? Cluster random sampling. Got it, everybody? Give me a thumbs up. ये क्वेश्चन गलत नहीं होना है. एंड दिस इज योर लोगो ऑफ मिशन इंद्रधनुष. करंटली वी आर इन 5.0. ऑल राइट, Mission Indradhanush 5.0, and this protects the children from how many diseases? 12 diseases. Okay, it protects the children from 12 diseases. So this was question number 6. Let's go to question number 7. Let me see your answer. In an outbreak of acute encephalitis in the community, a vaccination drive is scheduled. Which of the following is true about the vaccine SA-14-14-2 given in the outbreak? Now this can come in ionized set also, neat also, fmge. Now guys, as ionized CT approaches, okay, after we have finished the 50-day PSM roster where we are doing the topic weekly and then having a TND, when jab ionized CT will approach, I will have separate session for ionized CT where we will like practice on a stretch 10-day continuously 15 MCQs daily. Okay, then when FMG approaches again, we're going to have sure shot for FMG. But right now, this schedule that we are having right now, 50-day PSM, is for everybody. ठीक है, so that you don't lose your touch from PSM. ठीक है, क्योंकि आपको पता है it's so scoring. Yeah, everybody, so keep following the roster. It has been shared on Telegram group, Instagram, सब जगह है. उसको फॉलो करो और रोज पढ़ते रहो. 8 बजे रात को क्विज होता है, सैटरडे को TND होता है. ठीक है, चलो, व्हाट इज द आंसर ओवर हियर? SA-14-14-2. वेरी गुड. SA-14-14-2 इज गिवन लाइव वैक्सीन है एंड सबक्यूटेनियस है. 0.5 ml. On which arm do you give it, everybody? So it's given on the left upper arm. But nowadays in our national immunization schedule, which vaccine are we giving? We are giving the killed Japanese encephalitis. Okay, now we don't give this one, we give killed Japanese encephalitis. Gurmeet, vaccines included in Mission Indradhanush is your NIS only, dear. Let me finish, Gurmeet. Suno, question khatam karne do, then I will tell you what are the vaccines that are included. It's nothing. What you learn in NIS, those are the diseases it is protecting from. Okay, Gurmeet? ठीक है, अभी करेंगे. So live and subcutaneous, but now NIS may we give killed J, and that is given intramuscular route 0.5 ml. ठीक है, and that we're giving on the thigh. Okay, basically the left thigh is preferred over the right thigh. ठीक है, Okay. Moving to question number 8 for the day. A child has recurrent yeast infection and respiratory virus infection since he was 4 months old. Okay. All of the following vaccines can be administered except. Tell me the answer to this. मेरा नाक का यामा यूज नहीं होता. Nakayama Beijing are no longer used. Okay, so don't stick to that. J has live and killed both. Okay, but we don't use the Nakayama and Beijing now. Okay, we don't use the Nakayama and Beijing now. Okay, now see, a child has recurrent yeast infection. Recurrent yeast and respiratory virus infection मतलब बार बार अगर किसी को yeast infection हो रहा है, इसका मतलब the baby is the child is having some, his immunity is suppressed. Okay, immunity is suppressed. Immunity is suppressed. Okay, immunity is suppressed. Now, if the immunity is suppressed, live vaccine contraindicated. Okay, now see, IPV again is a killed vaccine, you can give it. Pentavalent is a combination vaccine, you can give it. PCV, guys, subunit vaccine, you can give it. Now J is available both as live and killed. Okay, it is available both as live and killed. Available both as live and killed. So by ruling out everybody, ये available होता है दोनों as live and killed. But by ruling out आपका आंसर क्या हो गया? Japanese encephalitis. Clear everybody, because Japanese encephalitis out of this is also available as a live vaccine and live vaccines are contraindicated. Clear? ठीक है, चलो. Going to question number 9. A patient dies following a visit to Africa due to hemorrhagic fever and jaundice. Administration of which vaccine strain could have prevented such an episode in the patient? RA273, RTS-AS01, Genvac 17D. What is your answer over here? Question number 9. Very good. 17D is the strain for yellow fever vaccine. Again, remember, yellow fever vaccine is a live vaccine. ठीक है, RA273 is for rubella. RTS-AS01 is for malaria. All right, it's for malaria. Genvac is for J. ठीक है, but Africa gave us a hint about the thing that yellow fever is endemic there, so you should have taken 70D. Now remember one thing, the validity of the vaccination certificate lasts lifelong. ठीक है, validity is now lifelong. Validity of the vaccination certificate is lifelong. Please remember that. Okay. And agar the person doesn't take the vaccine, then quarantine period for yellow fever is, this can also be asked, quarantine period for yellow fever, everybody is how many days? Is 6 days. Okay, quarantine period is done for whom? The contacts. All right, quarantine is always done for healthy contacts. Chalo, broken vaccine vial is discarded in which color bag? Don't make a mistake over here. Broken vaccine, no, quarantine is not 10 days, Vinay and Bhavya, quarantine is for 6 days. Okay, 10 days mein na validity of the certificate starts and it lasts lifelong. जैसे मान लो मैंने येलो फीवर का वैक्सीन लगाया, येलो फीवर वैक्सीन की सर्टिफिकेट की वैलिडिटी एवरीबडी, इट स्टार्ट्स फ्रॉम 10 day onwards and it lasts lifelong. Clear? चलो, what is the answer over here? Broken vaccine vial is discarded in. Okay, this was which question? 10th question. This is question number 10th of the day. This is question number 10. Yes, broken vaccine vial. क्या आंसर दे रहे हो सब? Why is everybody so confused? कोई येलो लिख रहा है, कोई ब्लू लिख रहा है, कोई वाइट भी लिख रहा है. सबसे पहली बात guys, please remember, vaccine vials are glass vials. Okay, glass vials, and glassware is going to be discarded in blue bag. Even if it is broken, ये मत सोचना broke हो गया है तो sharp में चला जाएगा and we're going to put it into white. No, it's a glass vial which is going to be discarded in which color bag, everybody? Blue. But if the question was live vaccine vial, okay, if the question was expired vaccine vial, okay, the vials that still have vaccine in it, okay, that means vaccines present, okay, vaccine present, then they become a biotechnology or a microbiology waste, in that case you will discard into a yellow bag. But otherwise if they just give you, ठीक है, या if vaccine in it then yellow, of course ध्रुव, तब yellow, expired हो गया है that means उसमें vaccine है, ठीक है, discarded है that means vaccine है, yellow. But अगर they simply say, if they simply wrote not broken also, if they wrote vaccine while discarded in, so even if they wrote vaccine while discarded in, it's discarded in blue. If they wrote broken vaccine while, it's discarded in blue. But if they write live vaccine while, expired vaccine while, then it is yellow. ठीक है. Vacutainers with blood is always yellow. Vacutainers without blood is going to go into red. Okay, expert witness, vacutainers with blood किस में जाएगा? Yellow. But vacutainers without blood will go into red. ठीक है. Question number 11, very common topic, ठीक है, NICTO, neetpg और fmge सब में आता है. As a medical officer of a PHC, you receive the open vials of DPT and PCV. What should be the course of action? Discard both the vaccine vials, discard DPT, use PCV, discard PCV, use DPT, use both DPT and PCV. What is your answer, everybody? Question number 11. As a medical officer of a PHC, you receive an open vial of DPT and PCV. What should be the course of action, everybody? So this is a very commonly asked topic. कौन सा topic है ये? Vaccine open vial policy. ठीक है? So what's your answer? Why am I not getting any answers, or have I missed your answers? Yeah, okay, somebody is writing. Now, not to be confused over here, open vial policy. Okay, vaccine vials once opened, guys, they can be used up to 28 days, provided of course the expiry date has not passed, they are maintained in proper cold chain conditions, all of those things. Okay, now what is the point that you have to note over here? Vaccines which follow open vial policy, please remember, vaccines which follow open vial policy, is all T series vaccine. ठीक है, सारे कौन से वैक्सीन है? All T series vaccine plus PO plus there is an update now, Genvac. Genvac means the killed J vaccine. Okay, and all T series means those that have letter T in it. So all the vaccines with letter T, including rotavirus vaccine. Okay, all vaccines with letter T, including the rotavirus vaccine. That means the Penta, the DPT, the TTs, the TDs, the hepatitis B, सब में letter T है. Plus तुम्हें क्या नहीं भूलना है? The rotavirus vaccine. Okay, this also has the letter T in it. Okay, PO. P stands for what? PCV. I stands for what? IPV. O stands for what? OPV. And of course, killed J. So 2 points जो आप याद रखोगे, which we have, which you might not see in the older video lectures. Now we've updated it. Rotavirus, जो new rotavirus strain है, जिसका नाम क्या है everybody? Rotavac. Okay, the name is Rotavac. This follows open vial policy. Okay, also Japanese encephalitis killed follows open vial policy. Clear? Give me a thumbs up. So you will use both DPT and PCV, T series vaccine, and PO, PCV, IPV, OPV. तो PCV भी आप use करोगे. Vaccines that do not follow open vial policy are all the reconstituted vaccines. Okay, reconstituted vaccines जिसमें you are adding a diluent, guys. Measles. Okay, MR. ऑल राइट, डिस्टिल वाटर ऐड होता है, ठीक है, BCG. ऑल राइट, वी ऐड नॉर्मल सलाइन. ओके, देन JE. ओके, JE का लाइव फॉस्फेट बफर. ओके, येलो फीवर, फिजियोलॉजिकल सलाइन, इवन द रेबीज वैक्सीन, द कोविड वैक्सीन्स, दे डू नॉट फॉलो ओपन वाइल पॉलिसी. ओके, दे डू नॉट फॉलो ओपन वाइल पॉलिसी. क्लियर एवरीबडी? क्वेश्चन नंबर 11 आ गया. ठीक है, अपडेट्स याद रखना, रोटावायरस वैक्सीन फॉलो करता है एंड किल्ड जापानीज एनकेफेलाइटिस वैक्सीन भी ओपन वाइल पॉलिसी फॉलो करता है. क्लियर? चलो, मूविंग टू द नेक्स्ट वन एवरीबडी. क्वेश्चन नंबर 12. ओके, now some screening questions on changing the disease prevalence in a community. Parameters changed are think and mark. This is a favorite. This is a 4-star question. What do I mean by a 4-star question? It has come in NEET, it has come in FMG, it has come in NICT, it has come in UPSC. सारे चारों एग्जाम में आया हुआ है ये पर्टिकुलर टॉपिक, नॉट द एग्जैक्ट सेम क्वेश्चन, द टॉपिक. ठीक है गाइस, क्वेश्चंस नहीं रिपीट होता है, बहुत कम चांस होता है क्वेश्चन रिपीट होने का. टॉपिक रिपीट होता है, इसीलिए PYQ का इंपॉर्टेंस है. ये मत सोचना कि सेम क्वेश्चन आ रहा है, नहीं. Question they'll change, they might change, but everybody, the topic they might not change. Okay, they are still sticking to this topic in all the exams. Okay, now see, I'm not getting a lot of correct answer here. मतलब अभी तक, चलो देखते हैं. Guys, तुम कुछ भूल रहे हो. Good, I've given this question. You're forgetting something. All of you are forgetting something. Very good. I've got one person who's giving the correct answer. Okay, 2 people have given the correct answer. Guys, okay, so SS, Bajrang Bali and Aisha so far. Guys, संदीप, श्रुति, ओके. गाइज, एक सिंपल सा रूल है गाइज. प्रेवलेंस डायरेक्टली अफेक्ट्स द प्रिडिक्टिव वैल्यूज. ओके, पॉजिटिव प्रिडिक्टिव वैल्यू इज डायरेक्टली प्रोपोर्शनल टू द प्रेवलेंस. नेगेटिव प्रिडिक्टिव वैल्यू इज इनडायरेक्टली प्रोपोर्शनल टू द प्रेवलेंस. नाउ वी कांट गो इनटू व्हाई. इफ यू हैव टू गो इनटू व्हाई ऑफ दिस, you'll have to refer to the main video lectures on prep ladder, but abhi I can't go into that detailing. Since exams are coming up, you need one equation, because एक ही MCQ आएगा. ये इक्वेशन याद रखो. एंड प्लीज रिमेंबर वन HYP over here, sensitivity and specificity of a screening test. Okay, please remember this HYP, the sensitivity and specificity. Oh, what happened to this? Just a second. What was I saying? The sensitivity and specificity of a screening test. Okay, sensitivity and specificity. All right, sensitivity and specificity of screening test is independent of prevalence, guys. Is independent of prevalence. Please remember, see, if the prevalence of a disease is more, then we'll be able to filter out more people. That's a different thing. ठीक है, बट डायरेक्टली द डिजीज प्रेवलेंस, ऑन चेंजिंग द डिजीज प्रेवलेंस, द पैरामीटर्स चेंज डायरेक्टली आर प्रिडिक्टिव वैल्यूज. क्लियर? बस ये एक इक्वेशन याद रखो. PPV इज डायरेक्टली प्रोपोर्शनल टू प्रेवलेंस, NPV इज इनडायरेक्टली प्रोपोर्शनल टू प्रेवलेंस. सेंसिटिविटी एंड स्पेसिफिसिटी ऑफ अ टेस्ट आर इंडिपेंडेंट. अगर कहीं प्रेवलेंस 30% है, एंड इफ आई एम यूजिंग अ स्क्रीनिंग टेस्ट हुज सेंसिटिविटी इज 90%, the sensitivity of the screening test will remain 90% even if the prevalence is 80%. समझ में आ रहा है? ठीक है, चलो. Tell me this one. ये कौन सा क्वेश्चन है? 13. So we are on question number 13. Time interval between first possible point of diagnosis and critical point of diagnosis is known as lead time, serial time, screening time, latent time. What is it? Everybody, very good. Guys. There's only, again, you're not reading. Why are you always in a rush? बच्चे, फिर से पढ़ो सारे कोई. That is why I've kept these sessions. Just because that's because you know that हमेशा lead time ही पूछते हैं screening chapter से, तो will the answer always be lead time? What is written, everybody? What is written? And then your one easy mark will go. You can't afford all that. Abhi you are seeing there's so much of 1 mark can make you get stuck at 149. 1 mark में आपका rank पता नहीं कितने हज़ारों पीछे हो जाता है. Yes, so फिर सबको पता था ना, everybody knew, but as soon as you saw, without reading, सबने क्या लगा दिया? Lead time. नहीं, don't do that mistake, guys. Please don't introduce bias into your question answer. Okay, don't introduce bias. क्या था? First possible and critical point. Screening time. Critical point. Screening time. Best time होता है. What is lead time? First possible point of diagnosis and usual time. Okay, and usual time of diagnosis. Usual time of diagnosis क्या होता है? When the signs and symptoms would have come. But here it is first possible point and critical point. Critical point is the optimum time. जब screening test लग जाना चाहिए. Okay, critical point is the optimum time. See, the best time to apply the screening test is this ideal time. Okay, this is the ideal time to apply screening test, the first possible point of diagnosis. But if I want to, sometimes you can't apply at first possible point, so at least you should apply at critical point. Okay, this is what the optimum time. Okay, this is what the optimum time when you want to get the benefit of a screening test. Okay, at least apply it till point, till at critical point. Everybody thumbs up. Serial interval क्या था? Time interval between primary case and secondary case. ठीक है, primary case and secondary case. And what is latent time, everybody? It is nothing but it is incubation period for NCDs, non communicable diseases. ठीक है, ऑल राइट. नहीं आयशा, क्रिटिकल पॉइंट क्या होता है आयशा? सी डायग्नोसिस कब मेक करते हो? एट यूज